Support for Gulf States Gumbo comes from the Britannia Theater, uptown in New Orleans, playing new movies, classics, and unique programming. Join the Britannia for Downton Abbey and One Battle After Another on 70mm film. Information at thebritannia.com for all showtimes.
From the Gulf States Newsroom, this is the Gulf States Gumbo, your weekly serving of stories from Alabama, Mississippi, and Louisiana. I'm criminal justice reporter Kat Stromquist, chopping it up this week. On today's show, if you've had trouble getting a COVID shot lately, you're not alone. People in Louisiana are running into a new obstacle when it comes to getting themselves or their kids vaccinated. There's confusion about who can get the shot and whether they need a prescription. Joining me is our public health reporter, Drew Hawkins, who has been covering this story. Hey, Drew.
Hey, Kat.
So, for starters, Drew, can you take us through what's different about getting a COVID shot this year?
Yes. Getting a COVID shot really used to be as simple as getting a flu shot. You would go into your pharmacy, you'd ask for a shot, they'd run your insurance, ask you some basic medical history, and, within a few minutes, you'd get the shot. And we're about to head into peak respiratory illness season, the fall and the winter. So this is when people are generally starting to go get their flu and COVID shots. And that's exactly how Matthew Morvant, he's a pharmacist and he owns Downtown Drugs, which is a small independent pharmacy in Covington, Louisiana. That's how he put it.
The second someone walks in and says they want a vaccine, it's our job to say, we got you, wait right there and we're going to handle you in just a second.
Okay, that all makes sense. We've all gotten a shot before. It's not my favorite experience.
Yeah, I don't think there's anybody who loves getting a shot, right? But, talking to Morvant and a few other pharmacists, they're saying it's gotten a lot more complicated this year. And that's because of changing guidance from federal health officials. So right now, large chain pharmacies, your Walmart, CVS, Walgreens, they're all requiring prescriptions now for anyone under 65 in Louisiana and 15 other states, including Alabama and Mississippi. And each of these chains, they have their own rules for children, and some of them aren't offering them at all. Walmart is not giving shots to anyone under 17 in Louisiana, even if they have a prescription. Morvant, the Covington pharmacist, he says he really doesn't even know what rules he should have for his own pharmacy right now.
So it's very confusing. I specifically don't know the actual guidelines at this moment.
Okay, so I feel like pharmacists need to know what the rules are. But if this isn't official policy or guidance, how'd you learn about it?
So I actually found this out myself, personally. I was trying to get my own kids the shot. And we ran into our pediatrician. She asked if we wanted to get a prescription because that might become a requirement or some pharmacies might be asking for that. And we said, sure. So she put it into the local Walmart pharmacy, which we don't normally use, but she said she'd heard that they had the shot available. So we were like, yeah, sure, let's go ahead and get it done, right? And then I called up Walmart and the pharmacist there told me, like I said earlier, that they weren't giving the shot to anyone under 17, even if they have a prescription. And, I'm a public health reporter, and that was news to me. So I made a few other calls. I called the local CVS. I called Walgreens. I got to listen to that wonderful hold music so many of us have heard before. And Walgreens and CVS said that they would give the shot to kids that were 5 and up, but they had to have a prescription. So then I went to the next level. I talked to Walmart corporate. They confirmed their rules that nobody under 17 in Louisiana could get the shot. CVS corporate confirmed the rules that their pharmacist said, that the rules are 5 and up with a prescription. And they all said that they're following state guidance. But the Louisiana Department of Health website says that kids as young as 6 months are eligible for a COVID vaccine. And it does not mention anything about a prescription. I did reach out to the state health department. And I also reached out to Louisiana's pharmacy board multiple times trying to get clarification, but neither of them got back to me.
Okay, that all sounds super confusing.
Oh, it is confusing, and public health officials are hearing this from people too. I talked to Dr. Jennifer Avegno. She runs the New Orleans Health Department, and she says she's getting a bunch of calls and texts from people who showed up at their pharmacy with a prescription and they were still told no.
I'm hearing nothing but confusion, Drew, and it's not just for kids. Because in the absence of standard guidance, that's what happens.
Okay, so why do these pharmacies have different rules about COVID vaccines? You mentioned something about federal guidelines.
Yes. So bear with me for just a second. I'm going to try to go through this as clear as I can. All right. So at the end of August, the Food and Drug Administration, the FDA, they issued guidance, their recommendations that people under 65 need to have a prescription for a COVID shot. So people have to prove that they have an underlying health condition. And then, just over a week ago, there's a vaccine advisory group at the Centers for Disease Control and Prevention, the CDC, and their recommendations were that everyone over 6 months should be able to get the shot, which is basically the same recommendations that we've always had. But they added this extra emphasis on what they called individual decision making. And what it basically means is that you have to talk to a medical professional, but that also includes pharmacists. The thing is, Louisiana has its own pharmacy law that does allow pharmacists to give vaccines without a prescription, but they have to be recommended by the CDC. But those recommendations, the ones I just mentioned from the CDC's advisory group, they haven't been formally adopted yet by the CDC, so they're not really technically official. So what's happening is pharmacies are taking, quote unquote, the safer route here, and they're requiring prescriptions now so that they can avoid liability later. And that's what Dr. Georges Benjamin, the executive director at the American Public Health Association, told me.
So everybody's basically covering you pick the word, okay?
Okay, interesting language.
Yeah, that's one way to put it.
But why isn't the federal guidance more clear?
So Benjamin says there's been a failure at the national level to harmonize these recommendations. And this is all under Health and Human Services Secretary Robert F. Kennedy Jr. And he's also been an anti-vaccine activist, and he's now remade the department with new directors and leadership, many of whom aren't scientists or have any medical background. Benjamin is a doctor, and he says COVID vaccines work, and they keep people from getting really sick and reduce the risk of them dying. And last year, the virus contributed to around 47,000 deaths in the U.S., so it's definitely still a thing. COVID is still here with us, and we're about to get into what is the peak season for COVID. And the way Benjamin puts it, the stakes are really real here.
People's lives are at stake, and they've just been incompetent. They've been incompetent in their decision-making. They've hired someone to run the health department who's not a great manager, who has no medical background, who's a lawyer, who has some pretty wacky ideas in a variety of areas.
Wow, okay. So much different from last year. I'd imagine even getting a prescription is an extra hoop to jump through, right?
Yeah, it's definitely an extra step, right? It's something you don't have to do for other things like the flu shot. And Matthew Morvant, he's our small independent pharmacist we heard from earlier. He said that adding this extra step of a prescription is definitely a barrier that's preventing some people from getting the vaccine. And he actually feels like it's intentional.
Now we're just deterring people from being able to get it. No one's being forced or anything. Now we're saying, no, you can't have this. And that doesn't sit right with me.
And there's also, of course, all this misinformation around COVID vaccines. Some people believe that they're dangerous or they're ineffective or they can cause autism or other health issues, which just isn't true. But Morvant says this is something he's heard too.
And if they think that, I would say, then just don't get it. That's, if 1% doesn't want it, it's fine. Then don't take it. But don't block the other 99% from getting it. That's just stupid.
So, okay, we have the federal level. What is going on at the state policy level here?
Yeah, Louisiana's politics does add another layer to this. There's the state surgeon general, Ralph Abraham, and he's been an outspoken critic of COVID vaccines, especially for children. And this is on official Louisiana Department of Health website in statements where he said that, CDC guidance for vaccinating children was woefully out of touch with reality. He wrote an op-ed for a site called The Center Square, where he went even further, saying that virtually every parent in the U.S. understands that COVID-19 shots for healthy children are a, quote, very bad idea. And he praised federal limits under Kennedy's, leadership. So that skepticism at the top of Louisiana's health department, it really stands in sharp contrast with the overwhelming consensus of medical research and national recommendations. So, I reached out to the LDH, and they haven't really changed or put out in their guidance, and they didn't get back to me. So it's really not clear what influence or what guidance they might issue, if any at all, that might differ from what the federal guidance will be when or if it's formally adopted by the CDC.
You talked about how parents may have trouble getting a shot for their kids, but one thing I wanted to ask about was seniors. People over 65 aren't supposed to need a prescription, right? Are any of them having trouble, have you heard?
Yeah, in all of the guidance, even though there's a lot of confusion and they don't always line up, one thing that has been constant is this idea that 65 plus, if you're over 65, don't worry about it. You don't need to get a prescription. You should be able to get the shot. But unfortunately, I am hearing about seniors who are not able to get the shot, whether they have a prescription or not. They're going to their local pharmacy and they're being told that they can't get it, right? And after this story came out, I actually got a note from some seniors, and one of them was a woman named Denise Haddock. She's 70 and she lives in New Orleans, and we hopped on a call, and here's what she told me about her experience.
Well, okay, so I went to Walgreens, and I foolishly just sort of thought everything would be fine. So I show up, and they said, oh, no, you need a prescription. And I went, okay, well, I thought it was only for people under, which I think is crazy anyway, but I thought it was just if you were under 65. And I am over 65. And so they said, no, everybody needs a prescription in Louisiana, and there's some other states.
And like I mentioned earlier, Dr. Jennifer Avegno with the New Orleans Health Department, she said she's hearing from others that are not able to get the shot, even if they do have a prescription. So, until the CDC formally adopts the recommendations of its own vaccine advisory group, or if Louisiana comes up with a clear guidance around COVID vaccines, there may continue to be more confusion.
And so what did end up happening with your kids? Were you able to get a shot for them?
The short answer is no, not yet. We're still working on doing that. We know that we can't go to Walmart, and we have called the Walgreens and CVS, and they have said that they are eligible for it. But a lot of these locations don't actually have the shot on hand. So this is another challenge here too. Does a pharmacy have enough vaccines, or do they have vaccines that are also meant for children? Do they have those at the location? So as of this moment, they have not, but we are working to make that happen. And, it's not as simple as it used to be, where we could just go knock out our flu and COVID shots at the same time as a family together, really. We just get this done, ahead of every winter.
Oh man, the struggle continues.
Yeah, the life of a parent.
That was public health reporter Drew Hawkins. Drew, thanks for talking with me.
Thank you, Kat. My pleasure. This was a lot to try to figure out, so I appreciate having the chance to go through it all.
Oh, and Drew, actually, before you go, normally we'd end the show with our Gulf States Gems segment, where we brag about things we love about our region. It maybe seems silly to ask in this case, but is there a gem for this story?
No, I'm actually glad that you are asking this, because I do have a gem, or gems, really. And that would be all of the readers and the listeners who reached out to me after this story came out. Like you heard earlier, we do actually live here. We are real people, us here in the Gulf States newsroom. My own kids couldn't get the shot, so we really do rely on our community to find out what stories are important to them, what's happening, and what they care about. I got emails, I got calls, I also got a bunch of comments on social media. I made a reel to go with this story, and a lot of people shared their experience and asked questions in the comments, and it was actually really helpful. If you don't follow us, you should. We're at Gulf States Newsroom on social media sites like Instagram and TikTok. And you can also email us at connect@gulfstatesnewsroom.org. So my gem, or my gems, are all of the people who responded to this story, which will actually be helping me report the next story.
Oh, that's so nice. Thanks for sharing that with me, Drew.
Absolutely.
This week's show is cooked up by the Gulf States Newsroom team. Our theme music is by DJ Supreme. Special thanks to our partner stations, WBHM, Mississippi Public Broadcasting, WWNO, and WRKF. You can find us in your podcast feeds every Friday. Look us up and be sure to subscribe. Again, I'm your host, Kat Stromquist. Thanks for listening, and don't forget to stir your brew.